Gingivitis means inflammation of the gums and is usually caused by excess buildup of plaque on the teeth. The condition is entirely preventable with regular and correct toothbrushing. Understanding the pathophysiology and risk factors is commonly tested. In terms of prevalence, it is estimated that 50% of the UK population is affected by gum disease, and more than 85% of people older than 40 years will experience gingival disease. Men are affected slightly more than women. The pathophysiology follows a clear progression that you should know. After toothbrushing, the teeth become coated in a mixture of saliva and gingival fluid known as pellicle. Oral bacteria and food particles adhere to this coating and begin to proliferate, forming plaque. Subsequent brushing removes this plaque buildup. However, if plaque is allowed to build up for 3 or 4 days, bacteria begin to undergo internal calcification, producing calcium phosphate, better known as tartar or calculus. This adheres tightly to the surface of the tooth and retains bacteria in situ. The bacteria then release enzymes and toxins that invade the gingival mucosa, causing inflammation of the gingiva, which is gingivitis. If the plaque is not removed, the inflammation travels downward, involving the periodontal ligament and associated tooth structures, a condition called periodontitis. A pocket forms between the tooth and gum, and over a period of years, the root of the tooth and bone are eroded until the tooth becomes loose and is lost. This progression from gingivitis to periodontitis to tooth loss is the main cause of tooth loss in people over 40. That sequence is worth remembering. Risk factors associated with gingivitis and periodontitis include diabetes mellitus, cigarette smoking, poor nutritional status, and poor oral hygiene. Gingivitis also worsens during pregnancy. The clinical features of gingivitis are characterized by swelling and reddening of the gums, which bleed easily with slight trauma, for example, when brushing teeth. Plaque may be visible, especially on teeth that are difficult to reach when toothbrushing. Halitosis may also be present. When differentiating, there are specific points to consider. Overzealous toothbrushing can itself lead to bleeding gums and gum recession, so you need to determine whether the patient is overcleaning their teeth. An electric toothbrush might be helpful for people who apply too much force when brushing. Gums that bleed without exposure to trauma, and where the bleeding is unexplained or unprovoked, need referral to exclude underlying pathology. Regarding dental hygiene advice that may appear in exam questions, dental flossing involves wrapping floss around the middle fingers of each hand, placing it between 2 teeth, curving it into a C shape around 1 tooth, sliding it between the gum and tooth until resistance is felt, then moving it vertically several times to remove plaque. Fluoride reduces dental caries. Most toothpaste contains between 1,000 and 1,500 parts per million fluoride. A low-dose toothpaste should be used for children under 7 years to avoid dental fluorosis, which causes tooth discoloration. Oral fluoride supplements can be given where fluoride in the water supply is less than 0.7 parts per million. The key exam points are that gingivitis is caused by plaque buildup, progresses from plaque to tartar to gingivitis to periodontitis, and is the main cause of tooth loss over 40. Risk factors include diabetes, smoking, poor nutrition, poor oral hygiene, and pregnancy. Unprovoked gum bleeding is a referral point. This video was brought to you by Pharmacy Skills. If you enjoyed this video and want to see more like it, Pharmacy Skills offers a comprehensive animated learning library covering the BNF, MEP, and general pharmacy training. Each video also includes practice questions and a range of revision tools to help support your learning. Visit us at www.pharmacyskills.com.